So March 15th of 2020 was the beginning of the COVID shutdown. This was great. I had plans, things to do. March 16th, I still remember, was a beautiful day. I decided to take the recyclables out, and I fell 4 stairs, needing emergency surgery, have a plate inserted, screws, and threads holding the ankle together. So the COVID shutdown was convenient because I could do in-home physical therapy. I could continue to be a director, attending all the required meetings, teach my students, see my clients, even volunteer my work pro bono for frontline workers and community-based organizations. This was awesome, or so I thought. About mid-2021, I began to feel exhausted, irritable, couldn't figure out why I was angry all the time, questioning. I had lost the passion for something I thought I loved. I was feeling zoomed out. I was really tired of looking at people from the neck up. I'm a high energy person. I like to talk. I like to see people. It wasn't clear what was happening. I know I felt increasingly isolated and disconnected from the people I loved, from my students and my co-workers. But of course, COVID meant you couldn't see anyone. So what was wrong with me? I'm a psychologist. I'm supposed to know these things. But I didn't. I was aware of the Gallup that reported that 23% of employees reported burnout, sometimes or all the time, with another 44% talking about mental health issues. But since the pandemic, the Glassdoor reports a 100% increase in burnout and a 143% increase in mental health issues. Those numbers are staggering. So we have to ask why. Well, it makes sense, doesn't it? So as you know, we think about the transition from in-person to now remote. What are we dealing with? Well, I know that I had students that were struggling with being in person remote and then having their little ones there. So at home it was only my husband and I. We just had the 3 dogs. That's it. I was the only one that had to work remotely. My students struggled with some having to do their work in a car. Because if you're living in a crowded apartment and everyone is with you, you don't have the privacy. Even my client had to go in a car to do therapy. What does it mean to do this? And let's talk about the inequities that really came to the surface during the pandemic. We assume everyone has a smartphone, right? We assume everyone has a computer, right? We assume everyone has internet service, right? Wrong. What we learned in the pandemic that there were pockets of communities that did not have internet service right here on Staten Island. Mind-blowing. The school system had to purchase thousands and thousands of Chromebooks from elementary school to college students in order for students to transition to work remotely. Huge. So of course, stress. I had students when they were doing the class and taking care of their babies. Many of them came to me and wanted to quit. Dr. Meléndez, I can't do this anymore. I just can't. I can't see clients online. I can't take care of my kids. I can't go to class. Let's talk about frontline workers. Not just nurses and doctors. But how about the people that were responsible to keep that place clean? Hurry up, clean, somebody left, hurry up, disinfect, make sure everything's taken care of. And also food service to make sure that people were fed. Wearing a mask all day long. Coming home with a rash. Having to work double and triple shifts. Because remember, through all this, you're also losing friends and family from COVID. And you're also sick. The fear of going home and now bringing this virus that's clearly killing people because you're seeing it every day and bringing it home to your family. reason for stress and increase. So why are we talking about depression and burnout in the same breath? Well, because the symptoms overlap. You heard me talk about feeling tired, exhausted, disconnected, feeling that I wasn't doing a good enough job, really questioning, is it time for me to quit? Is it time for me to retire? Not sure why. Feeling very disconnected and detached. Also reporting poor concentration. The other thing also, there's an increase in substance and alcohol use. More problematic if you were doing it alone. Depression is a mood disorder, as per the American Psychiatric Association, listed in the DSM, or what we call the Diagnostic Statistical Manual of Mental Disorders. Burnout is not considered a mental disorder. It's just recently been recognized by the World Health Organization as a syndrome, or what we call the WHO is the organization. Again, I say it's not the group, it is an organization. It is now listed in the International Classification as diseases as a medical condition, a syndrome, a set of symptoms. Next slide. Depression is something that fills you up inside. It is general. My clients often talk about this heaviness that they feel. Literally, their legs are heavy, their body's heavy. They don't have the energy to get out of bed, to take a shower, to brush their teeth, brush their hair. It is something that permeates every aspect of your life. It's not just about work, it's about family relationships, friendships. There's no trigger. You can't figure out why it's happening. The key symptoms in depression are a sense of worthlessness and hopelessness. This persistent sadness that sometimes clients talk about wanting to take their life. That's the alternative they have. For burnout, it is situational. It's directly related to a situation, your job. You're feeling cynical, as you heard me describe, cynical about the position, feeling like in efficacy, I can't do this anymore. I'm not good at this. You begin to question yourself. People report a sense of depersonalization. Kind of, they're doing it every day, but not really attached to what's happening. They're watching themselves. It's like, I'm just going through the motions. It is, again, a report about the job. Next slide. The good news is that they're both treatable. Depression needs a professional. Whether it's CBT, psychodynamic, solution focus, it is what you need. It is a collaborative effort between you and your therapist. You know, people think that therapy is that somehow I'm going to tell them what to do and they'll be better. And if that was the case, I would be really wealthy. But it's not. It's about you and the connection with the therapist to do the work. You may need medication, and that's okay. Medication doesn't have to be for life. Don't be afraid of it. It is about helping you get to do the work that you need to do. And again, medication is not something to be afraid of. For burnout, of course you could see a therapist. I believe everybody should go see a therapist. I'm a psychologist, right? Of course you want to go see me. But it's really about lifestyle changes. So what are the lifestyle changes that you make? It's really first learning how to say no. Setting boundaries, because the reason people have burnout is because they can't say no. They don't know how to set boundaries. They don't know how to take that vacation, how to take that lunch break. So that's the first thing, learning how to say no. What some are calling a quiet quitting. In essence, you're not quitting your job, but you're in your head really setting that boundary of what you're willing to do and not do with the employer. You can join the gym, but I have to say this. As someone that keeps joining the gym and never goes, it's not always about the gym. It could be setting an exercise program. If you're on social media, maybe picking a program where you could do exercise 15 minutes for yourself? Is it a manicure? Is it a pedicure? Is it a date night? Is it a date, lunch date with friends you haven't seen in a while? Making a concerted effort to do you. What is it that makes you feel replenished? It could be doing nothing. It could be deciding, and I'll tell you, I'm going to admit it right here, sometimes self-care is just vegetating in front of Netflix. And just binge watching something I haven't seen. So what is it that works for you? Taking personal time is really finding the work-life balance that you need. And what is that in defining it? Riding a bike, doing a walking routine. And for me, I joined a virtual walking group with women from all over the United States. One was in Australia. And it was 30 days, 30 minutes. And it was so challenging because I had to force myself to put on my sneakers and do the walk. And then present it. And that was reinvigorating as I began to see these wonderful women from all over the world, sizes, didn't matter if they were skinny, fat. We were doing the challenge to help me get through that. So really defining. And again, let me go back as we talk about depression to help you understand the difference between depression and burnout. If I take both these people and I send them to Aruba, 2 weeks, paid vacation, massages, facials, all the food you can eat. I don't know who's a foodie here. The depressed person will still be depressed in Aruba. Whereas the person with burnout will be like, yes, I'm going to enjoy this and come back replenished, rejuvenated to do the job, to help you really understand the difference. The good news, again, I said that they're treatable. So as we move forward, and we're kind of moving from remote to in-person, anxiety, depression, and burnout will continue to increase. And we ask why? Well, the pandemic taught us that people work really, really well remotely. We've done the job. But now we have to come back. And to add that we have spent the last 2 years watching the news over and over again. I don't know how many of you are news addicts, but you know there's a new diagnosis now, news addiction. So how does that impact us when we have to come back to work, take public transportation, now you're standing there really close to people, you're masked, they're not sure what it is, are they vaccinated, are they not, and they sneeze. Do they have monkeypox? Should I be worried? Is there a new variant? Oh my God, how do I do this? Not to mention that we're keenly aware of the mass shootings across the United States. Your babies are going back to school. Are they safe? Are the doors locked? Are the doors unlocked? What do I do? Cause for concern. So what do we do? So I say to you, listen. Listen to your body. Where do you hold that stress and that anxiety? Is it in your gut? Is it a headache? Are you grinding your teeth at night? Where do you feel it? Because our body holds the score. Know that if we don't take care of these things in enough time, know that they will impact us long term. High blood pressure, heart disease. It impacts definitely diabetes. For employers, I say to you, listen. Listen to your people, your employees when they come and say, listen, I really need a mental health day. And you don't say, BS. I don't take a mental health day. Why do you need a mental health day? A healthy employee is not just someone that's present physically, it's someone that's present psychologically. This and this is not separate. is to look at ourselves and our employees holistically. How do we make this place that stigma is not an issue? Let's dismantle the stigma when it comes to mental health. We have no problem telling people, they just changed my medication for my high blood pressure. I just switched from type 2 non type 1, I'm taking insulin. So I leave you with this message of a friend of mine. When I worked before this life, I was a headhunter on Wall Street. And my friend would go to lunch, and she was about 90 pounds, bubbly, 5 feet, and people say, where are you going? And she says, I'm going to see my therapist. It would be in my Latina head, I would say, why would you tell anybody that you're going to see a therapist? Because only crazy people go see a therapist. But what she taught me, not only about, she introduced me to manicures and pedicures for the first time, was about the importance of mental health. That she was not only taking care of the shell, she was also taking care of what's internal. So I leave you with loving yourself enough to do right by you because you matter. Thank you.